Hello everyone, welcome to Rad Chat Live at UKIO. My name is Namanjolka Anderson and I'm joined by fellow host Joe McNamara.
Hi everyone.
So really excited, we've got our next guest on. Would you like to introduce yourself please?
Sure. My name is Dr. Fredrick Lee. I am from the United States, specifically in California. And I have been here. This is my first time actually coming to England.
Really?
Yes.
And what's it been like?
It's been a lot of fun. I've had a lot of fun. The people are extremely nice. I went to London for 3 days before coming here to Liverpool, so I got to see all of the touristy sites for the first time. Yeah.
And see the difference between Southerners and Northerners.
Yes.
They're all, you get on the train or the bus up north and everyone wants to talk to you.
Yes.
And you go down south and everyone avoids eye contact.
Yes.
Yeah.
Yes. And that's the part I'm actually used to, because that's like the United States. Nobody talks to you. Everybody avoids eye contact.
Oh yeah, you get up in the north, you'll get everyone's life history, you'll share contact details.
You'll never make it where you want to go. At least in London we're efficient.
So tell us, what were you presenting here at UKIO?
So I was presenting on healthcare disparities, specifically in breast cancer, taking a look at the mortality rates and how they affect Black women disproportionately.
Okay, what got you interested in health disparities?
So this topic specifically because, one, I work in diagnostic imaging. I started as an X-ray tech back in 2002 and worked my way up into administration. So I've been tied to breast imaging professionally for many years. But then when my grandmother was diagnosed with breast cancer in the end of 2021 is really when I started, looking into different facets of breast cancer and how it affects people differently.
Thank you for sharing about your family member. Doing this work, have you found similar kind of stories of negative stories and things, and that's what fuels you to keep going?
Yes, actually I have. When I was doing the research and I was conducting the interviews with the patients, them telling me their stories and their experiences. One lady in particular, she was very appreciative just of me listening and asking the questions that I was asking, because she's like, no one has really asked me to about my journey, about my experience. It's all about the treatment and the follow-ups, but no one is checking in with me individually. So that was very, very, very beneficial, and so that helped me to stay focused on the research.
So what did your research find?
So the research found that self-efficacy is a major component in determining a patient's healthcare outcome. So the patient has to have a belief that their actions will contribute to a positive health outcome. So some of the patients, all of the patients had previously been diagnosed with breast cancer and had reached at least 1 year of survivorship. And so I was asking the question of why is this happening? What contributed to your survivorship, since it would be quite difficult to discuss or interview the patients who did not reach survivorship. So yeah, it's definitely been eye-opening. And I was quite taken back by how much information I didn't know. Coming from operations management in diagnostic imaging, the patients will come to our department first, right? That's where you go for your screening mammogram and then subsequent follow-up appointments. So diagnostic imaging plays a critical role in shaping the patient's experience, and from that experience, the patient then builds trust in the system, and that determines if they continue or how they continue their follow-up care.
Can I ask, because you were primarily speaking to females and women, how did they find opening up to you about their experiences?
None of them voiced any reservations about me being a guy and getting into it, because it was mostly about their experience versus the intricacies of their diagnosis. many of them were appreciative of the fact that, someone was asking, and particularly a black man was asking them, and doing this type of research, just because there's not a lot of male presence in this space.
So from the work that you've done, what advice would you give healthcare professionals to ensure that this health disparity doesn't exist?
My advice would be one size fits all approach to care is not working.
Yeah.
If it did, we wouldn't have the disparities that we have. So I think it's important to individualize the care for the patient, and to make sure that the patient is empowered. The patient needs transparency. They need to understand what's involved. They need to be able to make informed decisions, and they need to be included in that decision versus, a lot of the women went to the doctor and felt like they were just being told what to do and what comes next versus given the opportunity to decide for themselves.
Yeah.
So that's really, really important.
There's just so much to do, isn't there? And I don't know, like I obviously like the health inequality space as well, but every time you go into one aspect of care, you keep going, you find more. And then there's the intersectionality of other problems that obviously go into different things, and it's just hard sometimes.
Yeah, the more you know and the more you learn, the more you realize you don't know. It's kind of like tumbling down the rabbit hole. You think you're on a right track and you're coming to a solution, and then just as you said it, there's this intersectionality of other issues or other compounding factors that come into play that complicate the entire situation.
So what's next for you? Has this spurred you on to want to do more research, more projects?
I would love to do more research in this space, more projects. Right now, because of the reception of the topic, I think speaking more about the findings from the research and just having those conversations is a good start. So next steps for me is continuing to get this message out.
Is it published?
Not officially, no, but it is available on ProQuest. It's called Empowering Black Women, Navigating Breast Cancer Care and Survivorship. It is my 250-page dissertation.
Amazing.
That I finished for USC a couple years ago.
Perfect. We'll be sure to share the link for you.
Awesome.
Thank you so much for joining us on Red Chat.
Thank you.